At the beginning of the pandemic, we were told to avoid wearing N95 masks to save them for healthcare workers. But now there's a surplus of masks and facial coverings on the market. And some public health experts argue that it's time to reevaluate which ones give the best protection. For more on this, I want to bring in Aaron Collins. He's a mechanical engineer with a background in aerosol science. He's also known on YouTube as the Mask Nerd. Aaron, good to have you here. You are a connoisseur of masks. So tell us, first of all, what those letters and numbers mean, N95, KN95, and tell us ideally what kind of mask should people be wearing now?
Yeah, that's a great question. So I think the best mask to wear is one that's on your face. So we can talk about, the basic cloth mask that we've all worn in the beginning of the pandemic, sort of our 1918 pandemic technology. But we actually have some really great technology that's come around since the last 100 years to really help provide protection both for others and to yourself. And so you kind of hit on that. There's all these standards out there, these KN95, KF94, and N95. And what those are what we call better masks or high filtration masks, or the technical term is a respirator. And they feature some technology in them. They feature a non-woven electrostatically charged melt-blown material. And what that does is that it features, like, we actually have it in our surgical mask, the kind of very base level surgical mask actually features that material. But what's different between like a surgical mask and a respirator is that they're designed to fit to the face. And so surgical mask has the technology, but doesn't have the fit, and it doesn't really have necessarily the comfort because it kind of sucks to your mouth. And so the KN95, that's a very common standard. You've seen these all the time out there. And this is actually a Chinese respirator standard, which is just a test standard. There isn't a lot of government regulation to these. And so you've heard about a lot of fakes of these going around and stuff like that. So that's what these are. And then, of course, you have like the KF94. That's a style that comes out of South Korea. They look like this. And again, that's a respirator standard, high filtration material, great fit. But typically the only difference is it comes with ear loops, same with that KN95. And then the N95 is the US standard. They look like this, and they're gonna feature headbands. And so what are those? Each are surgical masks, KF94, KN95, and the N95 are just improving levels of filtration, inhalation protection, and also source control.
And the 95 in that refers to the percentage of particles that it filters out, is that right?
It does. I think there's a little bit of a misnomer there because I think the minimum standard is a 95% filtration, but it's actually at 85 liters per minute, which is a technical term, but it's equivalent of basically running at like 80% of your max power. And so in practice, these masks actually filter in terms of respiratory droplet nuclei. Those are the stuff that contain COVID. These actually typically filter at like 99% filtration or better. And so it just really comes down to like face fit, finding a mask that fits you on your face. And that includes N95s, KF94s, and KN95s all really have really high filtration efficiency at moderate breathing rates.
And you explained that those respirators in part are not just physically blocking, but that they're electrostatically charged. And how long does that last? Because I know I'm guilty of wearing them over and over again, and I don't know when I'm supposed to be throwing them out, in all honesty.
That's a really great question. So I actually did some experiments on some KF94 masks, and I found after over 40 hours of wearing in an indoor office type environment, so that's a clean office environment, so this is excluding construction zones and stuff like that. But I found that 40 hours, there was no real measurable change in the filtration efficiency. And this matches other people's work to do this. So in general, my recommendation is you can wear them for about 40 hours. Typically what you find is that the headbands or the ear loops start to lose some of their strength. And that's usually the sign that you should stop wearing it, or 40 hours, whichever comes first.
Okay, I'm really nerdy on this. When you say 40 hours, you don't mean 40 hours from the package. You mean 40 hours FaceTime.
That's correct. 40 hours on your face wearing it. Yeah, that's a good point. In fact, once you open the package, they can actually be stored for a very long time. They don't expire just sitting out, fortunately.
So let me ask you about cloth masks, Aaron, because one of the things that's really attractive about cloth masks is that they're nearly infinitely reusable, not to mention that many people find them more comfortable. In what circumstances are those appropriate? And is there a big difference between the ones that have those built-in covers or the adjustable ear loops or the built-in nose pinchers and the ones that are just fabric?
Yeah, so that's a great question. So in general, I mean, I look for there's a standard that came out in the US called the 3502. Us nerds love these number systems. They make no sense to the consumer, but my apologies. Those feature what the CDC recommends, which is a cotton material or non-woven, or cotton or polyester material, then a non-woven polypropylene layer, and then cotton. So there's like a 3-layer mask. That is, to me, the minimum basics. And even those typically only offer around 60% filtration efficiency. What typically kind of blows people's minds, and why I try to push people away from cloth masks, is a lot of the features that you talked about, a really strong nose wire and ear loops, are available in the KF94 standard and KN95, but I really recommend the KF94 standard. They're available in that. And the thing that I've measured is that the pressure drop, or how hard it is to breathe in the mask, between a KF94 and a cloth mask, these oftentimes, the mid to high end ones, are easier to breathe in. That's kind of mind-blowing to a lot of people. They think they're hard to breathe in. They think respirator must be difficult. In fact, they're easier to breathe in. And that's kind of the thing that I'm trying to highlight, is we really have some really great technology out there right now. And so that oftentimes mid to high-end respirators are more comfortable and easier to breathe in than a cloth mask.
It's interesting, Aaron, as you're talking about how the technology has changed and just our supplies have changed. I remember in the beginning, we didn't have this, and so we were being discouraged from wearing it. You review tons of masks on your YouTube page, and as I understand it, you do this without making money in order to preserve your impartiality. So tell us, what have you found, especially as we are looking forward to the holidays, and a lot of us are looking forward to traveling with kids who potentially haven't been vaccinated because they are too young. What are the most effective masks for adults and children?
That's a great question. So yes, the supplies are back, and there is an ample supply of places to buy. So I recommend, if you want kind of the entry level protection, a KF94, KN95. Now you can get those in a variety of places. They're actually US made KN95s, which is a little bit of a weird standard, but companies like Armbrust or there's a lot of online outlets to get these, and so I recommend that. Now, kids, when we go to the adults, there's N95s available, and there's a lot of options. You can go to Home Depot, get the 3M 9205. I like that mask a lot. There's a ton of great N95 options out there right now, too. N95 Project, great place to go and find some of those. And for kids, they actually make small masks, KF94s, available in kids. They come printed like this. Also a great option for traveling around with kids. Again, you can get excellent filtration. All of these have really high filtration efficiency, and typically, as worn on some kids, I've done some tests, about 90% protection, whereas a cloth mask would give you 50%. So that's my recommendation. We got better masks out there. You can find them all day online. My only recommendation is to avoid Amazon KN95s. There does seem to be a little bit of a problem with some fakes out there. Otherwise, other outlets and stuff like that, US made, great option. Tons of US made N95s out there right now, too.
You know, it's practical, it's nerdy, it's hitting all my sweet spots. Aaron Collins, thank you.
My pleasure. Thank you.